Talk about things that can impact the hearing, speech, or vision problems today. So these are common things that we see with our elderly population. So we'll take a look at some of the things that happen, some of the disease processes that occur. So when we just look at just basic risk factors, that we're going to talk about ear issues first. And when we look about just risk factors that can damage the ear structures themselves, aging can, okay? I mean, aging, the ears can kind of start to atrophy a little bit, just like the rest of the body tends to. Exposure to loud sounds and loud noises can damage the ear canal and the inner ear components and end up causing people with hearing loss at a much earlier age. Drugs. So certain antibiotics, too much aspirin, those are medications that can actually damage the ear canal and can impact hearing on a long-term basis. And cancer patients that have gotten chemotherapy, sometimes chemotherapy can actually destroy some of the ear structures as well. Infections can, repeated ear infections can cause damage, long-term damage and scarring and stuff in the ear canals, which can impact hearing. Reduced blood flow to the ear, or if patients have had strokes or head injuries, those are things that can actually damage the ear structures and impact, ear issues. Tumors. Some people are born, their heredity factors can, of course, the person can be born with damage to their ear canals or ear structures and birth defects. So the first disease process we'll talk about is otitis media. Now, otitis media is just an infection of the middle ear. So if you remember here, we have the outer ear. So we have the outer ear, we have the middle ear right here, like where the eardrum is, and then we have the inner ear. So this is usually the infection of the middle ear, so it's in this area right here around the eardrum that you'll usually see fluid and a lot of times an infectious process happening in there. Otitis media can be caused by viruses or bacteria, and it can be acute or chronic. And what I mean by acute is you get this ear infection, it comes on suddenly, you take some antibiotics, it goes away, you're good. Some people will have chronic ear issues where they just get infection after infection after infection, and it never really quite clears up that well. And sometimes, it used to be really common for kids to have tubes put in their ears, but nowadays they tend not to do that quite as much because they find that a lot of these kids just end up with ear infections around the tubes. So I know one of my daughters, my youngest daughter, she had ear infection after ear infection after ear infection. And she had so many chronic issues with it that they put her on low-dose antibiotics. They actually put her on antibiotics to get rid of the ear infection, and then they put her on some low-dose antibiotics just to keep it from coming back for a little while, to keep her ears clear for a while. And that lasted for about 8-9 months, and then she finally got to where we could get her off the antibiotics, and we didn't have any issues with it after that. But when a person has an ear infection, they usually have a lot of pain in that ear. It's very uncomfortable. And so if it's a little kid, they'll be crying a lot. Older kids, of course, and adults can tell you that they're having pain, that it's really bothering them. Hearing loss. Sometimes the fluid buildup is so intense in the ear and the infectious process is so intense that it's going to keep the sounds from coming through correctly. And so they'll have temporary hearing loss while the infection's going on. Fevers, of course, they may be running a temperature. And then tinnitus, which is a ringing or a roaring in the ears, is fairly common. Now, treatment with otitis media, generally people will go on antibiotics. So I know we've talked about, when we talked about our infection control section, we said we really don't want to overuse antibiotics, but when they have an ear infection, they usually need those antibiotics. They'll usually need medication for pain relief, and it may be something just as simple as Motrin or Tylenol, but it is very uncomfortable. And so usually they'll take something, we'll usually give them antibiotics, something for the pain management, and then if they have any type of congestion, sinus issues or cold issues going on with that ear infection, we give them medication to help relieve the congestion. That'll kind of help decrease some of that fluid that's building up in that ear. Another disease process that we look at, and this one's more common with our elderly, is Menieres disease. It's a common cause of hearing loss in our elderly population. And people end up getting a fluid buildup in the inner ear. So remember we said we have our outer ear, our middle ear, and then we've got the inner ear here. And they get fluid, like this lymph fluid that starts building up in this area. and it causes severe pain. They have severe pain in this area, and it usually affects one side at a time. Sometimes people get it on both sides, but most of the time it's one side at a time. They have this horrible pain and pressure in their ear. Hearing loss, because there's so much fluid in there that the sound isn't going through correctly. And then it causes what we call tinnitus, that ringing or roaring in the ears that we mentioned with the otitis media. And it also causes vertigo, a dizziness. So when people stand up, when they move, when they reposition, everything kind of starts spinning. So usually just one ear is affected, and we will usually give people medications, pain control medications, and medications to try to get rid of extra fluid. During these phases, these bursts of this pain and this fluid buildup in the ear, sometimes it comes on and it'll last a couple hours, sometimes it can last for days. But they'll usually do fluid restrictions and low salt diet so they don't tend to retain more fluid. And we recommend no alcohol, no caffeine during this time period. And like I said, they'll usually need medications with it for this as well to get through it. Now, hearing loss is another really common problem. And so hearing loss can be from mild to severe. Deafness is hearing loss in which it's impossible for the person to understand speech through hearing alone. So when a person is deaf, their hearing is so bad, it's not just hard of hearing, they cannot interpret speech at this point anymore. So hearing loss tends to occur in all age groups. 1/3 of Americans over 60 years of age have hearing problems. And about 50% of the people over 85 have hearing loss. So as you get older, the risk of it is going to get much higher. It can be temporary or it can be permanent. This here is one of the causes of temporary, believe it or not. It's just earwax. Curcumin, which is a fancy word for earwax, can cause temporary loss. And I remember working in the emergency room when we had a gentleman come in and he's like, I can't hear anything. It's like all of a sudden my hearing's gone. And the doctor went and looked in his ear and he says, there's so much wax I can't even see what's going on. So he had me irrigate the ear. He put a couple drops in the ear to soften it up, and then he had me actually irrigate the ear. And I was irrigating it, and this huge, this piece of wax, it was nice and dark like this picture, but it was probably almost as big around as my thumb, the tip end digit of my thumb. And all of a sudden it started coming out as I was irrigating it, and as soon as it came out, he was like, oh my God, I can hear. He goes, that's a miracle. It was just earwax. It's a very common cause of hearing loss, believe it or not. So sometimes it can be just a temporary thing. It can be just a really simple thing from too much earwax buildup. It might be from an ear infection. It might be something like Menieres Disease. And then once you take care of the infection, or once you take care of the Menieres Disease and get the fluid under control in the ear, they'll end up having their hearing back. But as I said, 1/3 of Americans over 60 are going to have some permanent issues, and 50% over 85 are going to have some issues with it. Hearing is needed for speech. Hearing loss can result in slurred speech if you're not hearing properly. Even your own voice is what's coming out. It makes you sometimes pronounce your words wrong. Sometimes people have a real monotone speech, or they'll drop word endings, and it can be really hard to understand what they're actually saying. So people who do have hearing loss, generally they tend to lip read. Some will have hearing aids, and the hearing aids may correct the problem for them. Some will lip read, and so you need to make sure when you are talking to someone who has a hearing loss, you make sure you get their attention before you start talking, and you make sure you face them so they can see your lips, so they can see your mouth. Sometimes they can read your lips and determine what you're saying. Watch your facial expressions, your gestures, and your body language. And then the other thing is with hearing loss is a lot of people will learn, of course, American Sign Language as another way to communicate. A lot of people will have they have hearing assistance dogs. Hearing aids are electronic devices that fit inside or behind the ear. So we've already kind of looked at hearing aids in a previous class, but they do make sounds louder. And unfortunately, they don't correct the underlying problem. So they can't restore or cure any of the hearing loss. It can just amplify sounds so they can hear with the damage that they have. So the person hears better because the device itself is amplifying everything and making it louder. The problem is it's not just the words they want to hear, it's all the background noises get louder as well. I know it really frustrates a lot of people. They'll choose not to wearing their hearing aids just because all the other noises just get so much overload for them that it's almost overpowering to them. But if a hearing aid doesn't seem to be working properly, check to make sure your hearing aid's actually on. That they do have on-off switches. So if your resident is telling you they can't hear and they've got a hearing aid in, make sure that the switch is on. Check the battery position and insert a new battery. You can get new batteries. Usually the nurses have them up in the med cart. You just ask for a new battery and you can put that in. And then also we just need to make sure it's clean. We want to make sure that there's no wax buildup in the holes, where the sound is going to be able to come out. And so when we do clean them, we clean them with a very soft cloth. We don't run them under water, obviously. And they don't usually recommend that you clean them with alcohol either. It can kind of dry the plastics out a little bit faster, but usually just a nice soft cloth. So they have different types of hearing aids. They have really small ones that just fit right into the ear. And you can usually tell which ears they go into by where the hole is as to whether it would go in the right or the left side. But usually there's writing on them as well. And the writing in red usually goes in the right ear. So red is right. And then the left ear is usually written in blue or black. So they have different size hearing aids, some that kind of drop pretty far down into the ear. They're not very noticeable. They have some that are a little bit larger, so you won't be afraid of it going in too far. They have some that will fit the ear perfectly. They have some that go over the ear, and there's a piece that will drop into it. There's all different types of hearing aids, and they will see a hearing specialist to determine what would work best for them. And I do want to mention here, and I know we've talked a little bit about this before when we've looked at hearing aids or helping a person with hearing aids, but make sure when you're dealing with hearing aids, if you do have to change the battery, if you do have to do something with them, handle them very gently. They're extremely expensive to have to replace them if we accidentally break them. As far as speech disorders result in impaired or ineffective oral communication. And so speech disorders may happen from that hearing loss because, again, we need our hearing to be able to communicate correctly. But also people that have developmental disabilities or brain injuries may have speech issues as well. So some people will need speech rehabilitation. The goal is, of course, to improve the person's ability to communicate. And the amount of improvement is going to depend on what's causing the problem, the area of the brain damage that's happened, the person's age and health, the person's willingness and ability to learn. So that's going to impact things as well. If a person has a head injury and they're older, and especially if they've already have any type of cognitive impairment, it may be very difficult for them to be able to get past this. But a speech language pathologist and other health team members will help try to teach them new language skills, to use their remaining abilities as best as they can, to restore language abilities to the full extent possible, to learn other ways to communicate. If they can't speak anymore and they're having a hard time getting their words out, how are they going to learn to communicate? So, we'll teach them other ways that they can learn to communicate. And then they can also give them exercises to actually help strengthen the muscles of the speech. The term aphasia, so it's not the same as dysphagia. Aphasia, it's spelt different, okay, is the total or partial loss of the ability to understand language. So a really common cause of this is a stroke. So we see this a lot with strokes, and we'll see this with head injury patients where it's impacted the area of the brain that impacts speech. So there is what we call expressive aphasia and receptive aphasia. So expressive aphasia means you understand what's being said, you just can't get the words out to what you want to say. You know what you want to say, you just can't get the words aren't coming out correctly. That's expressive aphasia. And receptive aphasia, it is your difficulty being able to actually interpret what other people are saying to you. It's not processing incorrectly. And a lot of people will have both. So they will have what we call expressive receptive aphasia, and they have a hard time expressing themselves and understanding as well. So a lot of times people that have difficulty with the inability to understand language, they're going to have a lot of emotional issues as well with this. Now, as far as eye disorders go, vision loss can occur in all ages, but problems range from mild vision loss to complete blindness. And being blind, obviously, is the absence of sight. Vision loss can be sudden or gradual in onset, and one or both eyes can be impacted. So common eye issues we see with our elderly population is cataracts. It's a clouding of the lens in the eye. And so people have cloudy, blurry, or dimmed vision. Colors seem faded. Blues and purples tend to be hard to see. Sensitivity to light and glares. Poor vision at night. Halos around lights. And double vision in one eye. The most common cause of it is just aging. It's the most common cause of it is aging. Now, people that are diabetics, people that smoke, people that abuse alcohol have a higher tendency for this to happen, especially as they get older. But aging is the most common cause of it. And also we see it from prolonged exposure to sunlight as well. Family history of cataracts can put you at more risk for it. And the only treatment they have for cataracts is surgery, but fortunately, it's a fairly easy surgery. So they actually remove the lens and they put a new plastic lens implant on it, and then the person can see beautifully. Okay, so it actually is a fairly simple procedure. This is kind of what it looks like. Here would be normal vision, and a person with cataracts, you can see how everything's blurry, hard to focus in on it, and especially at night, especially with lights, you'll see that. So really blurry vision. Another common thing we see with our elderly population is age-related macular degeneration, AMD, and it blurs central vision. So the disease damages the actual macula located in the center of the retina. It tends to be gradual in onset, and it's painless, and that's the problem. It is painless. And so people don't realize it's happening until they actually already start having some eye damage. Very important to get your eyes checked regularly, especially as you're starting to get older. You know, that's one thing I have to say. People that have to wear eyeglasses, so I wear eyeglasses, I go get my eyes checked every single year. My husband still doesn't wear eyeglasses, and it's like pulling teeth to get him to go see an eye doctor because he doesn't think he needs to because he doesn't have any problems with his sight. But when you go in for an eye exam, they check for cataracts, they check for age-related macular degeneration, they check for glaucoma. So it's really important to get your eyes checked because these things can lead to blindness, and they're very preventable, very preventable. So it is painless, leading cause of blindness for people over 60 years of age. And there's what we call wet macular degeneration and dry macular degeneration, and you don't really need to know the difference between those at this point. But I do want you to know that age-related macular degeneration, it is common cause of blindness, and it causes the loss of the central vision. So here's a picture of what I'm talking about. You can see here the person's periphery, everything is crystal clear, but it looks like there's just a hole missing. And what you're going to see is people that have this, that have AMD, they're going to look, when they're talking to you, instead of looking at you directly, they tend to look at you like this so they can catch you in their peripheral vision. So it looks like they're not making eye contact with you, or that you think, oh my God, they're being rude or something. They're trying to see you, and they can't see you by looking straight at you. So treatment is to keep the disease from progressing. They can do laser treatment. Healthy diet, not smoking, and maintaining normal blood pressures can help keep it under control. Doesn't take care of it completely, but it can keep it under control. Now, another really common eye issue is glaucoma. And this is where fluid builds up in the eye and puts pressure on the optic nerve, and it actually damages the optic nerve. So vision loss with eventual blindness occurs. It can develop in one eye or both eyes. And onset it can be sudden or it can be gradual. So some people have no issues with glaucoma, and then just boom, all of a sudden, they can't see out of their eye. Other people, it's a slow, gradual process. But in this one, you lose your peripheral vision. So with AMD, you lost that center. You can see around the periphery. With glaucoma, you lose the periphery. You can see in the middle. Glaucoma does not have a cure. Now, I say it doesn't have a cure, but actually they do surgery now. They can do laser surgery, which can help actually control it, so you don't usually even need to take medication anymore. Otherwise, medications, eye drops, will help decrease the pressure. But any prior damage that you've had isn't going to be able to be reversed with it. So here is what vision would look like here. You've got your center vision, but you tend to lose that periphery. So when a person does wear glasses, when you're taking care of a person that wears glasses, use both hands when you put your glasses on. Please take them on and off this way. Okay, with both hands. Do not do this to the person where you go like this. It stretches these out, and they can't always, depending on the type of frame, can't always be bent back in, and then they're going to be too loose, and the person's going to bend over, and they're going to fall off a lot. The other thing is don't put the glasses down on the table this way. Don't ever put the glass part on the table. Always make sure you fold it and that it goes on the frame itself. When you do clean glasses, you clean with a very soft cloth. Don't use a regular towel, like a regular washcloth or a regular hand towel. Those are too rough. So clean with a nice soft cloth. If needed, you can wash them with a cleansing solution or put them under warm water in the sink and then just dry them with a nice soft cloth. You can wash the frame as well. And then when they're not in use, they should be put in a case. So if the person has an eyeglass case, make sure you put them in the eyeglass case so they don't accidentally get bumped off the table or something else doesn't get thrown on it. And that is going to take care of our vision, hearing, and speech issues.